and perform hand hygiene. Hi, my name is Haley. I'll be your student nurse today. What we're going to be doing is we're going to perform a head to toe assessment on you. And I'm going to have to touch you. Is that okay?
Yeah.
If at any point this gets uncomfortable for you, just let me know and we'll stop, okay?
Mm-hmm.
All right. Can you tell me your name and date of birth?
Cassie Hubbard, 2/6/2000.
Okay. Can you tell me where you are?
Southern,
Do you know about what time it is?
11.
Okay. Do you know who the president is?
Donald Trump.
Patient is alert and oriented ×3 to person, place, and time. Patient's posture is comfortable and relaxed. Patient's mood and effect in the facial area is relaxed and comfortable. Okay. What I'm going to do now is I'm going to inspect your hair, okay? Patient's hair is brown, clean, and dry with no lumps, lesions, or infestations. Can you tell me if it's in any tenderness?
No.
Okay, no tenderness is noted. Okay, I'm going to check your skin. Patient's skin is warm, pink, and dry, and smooth, and firm. Skin turgor is less than 1 second. Bilaterally, patient's nails are clean, no clubbing is noted, and patient's capillary refill is less than 1 second in both hands. Okay? What I'm going to do now is I'm going to do your face, okay? Patient's head is normocephalic, face is round and symmetric. Okay, and now I'm going to have you to cover your eye. Alright, and I'm going to have you tell me when you see my pen light.
No.
Okay, the other eye.
No.
Cranial nerve 2 is intact. What I'm going to do now is I'm going to look at your pupils and I'm going to see how they constrict to light. Patient's pupil size is a 5 bilaterally and constrict to a 3. Patient's pupils are equal, round, reactive to light, and accommodations. Okay, what I'm going to have you do now is I'm going to check your nose, okay? Tell me if you have any tenderness. Okay, what about here? Patient's frontal and maxillary sinuses are non-palpable and no tenderness is noted. Patient's nose is midline and symmetric with no lesions or deviations. I'm going to have you close off one side of your nose and breathe in and out for me. Great, now the other side. Patient's patency is equal bilaterally. Patient has no complications with breathing out of nasal. Okay, patient's lips are symmetric, smooth, and dry. Okay, do you care to open up for me? Patient's buccal mucosa is pink and moist. Tonsils are +1. Can you stick your tongue out for me? And say ah. Okay, and can you tell me what you taste?
Sour.
Okay, cranial nerve 7 is intact. Can you swallow for me again? Patient's cranial nerves 9 and 10 are intact. Patient's teeth are clean, white, and in line, and no dental caries are noted. Can you open up for me real quick? Yes, no dental caries are noted. Patient's palate is also smooth and moist with no lesions or abnormalities. Okay, I'm going to have you to close your eyes for me and tell me when you feel this sensation.
No. 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 No.
Okay, I'm going to have you to clench your teeth together. Okay, cranial nerve 5 is intact. What I'm going to have you do now is raise your eyebrows, smile, and puff your cheeks. Cranial nerve 7 is intact. Now I'm going to look at your ears, okay? Patient's ears are symmetric bilaterally. Patient's ears are warm, pink, and dry with no discharge noted. Do you feel any tenderness? Patient has no tenderness in either ear. What I'm going to do now is I'm going to look inside of your ears, okay? Patient's tympanic membrane is pearly gray and cone of light reflex is noted at 7 o'clock in the left ear. Okay, and in the right ear, patient's tympanic membrane is pearly gray and cone of light reflex is noted at 5 o'clock in the right ear. Okay, what I'm going to do now is I'm going to come behind you and I'm going to palpate your lymph nodes, okay? And tell me if you feel any tenderness. Preauricular,
No.
posterior auricular,
No.
occipital,
No.
posterior cervical,
No.
submaxillary,
No.
submandibular,
No.
submental,
No.
jugulo-digastric,
No.
supraclavicular.
No.
Okay, patient's lymph nodes are non-palpable and non-tender. Okay, what I'm gonna have you do now is, I'm gonna go ahead and check your epitrochlear lymph nodes, okay? Patient's epitrochlear lymph nodes are non-tender, palpable bilaterally, okay? Now what I'm gonna do is I'm gonna have you close your eyes and tell me what you smell.
Vanilla.
Patient's cranial nerve 1 is intact, okay? What I'm gonna do now is I'm going to have you to cover one ear and I'm going to whisper into the other and you repeat the phrase back to me, okay?
ABC. 1, 2, 3.
Cranial nerve 8 is intact, okay? All right, now what I'm gonna have you do is I'm going to go behind you and I'm going to I'm gonna percuss and listen to your lung sounds, okay? Okay, tell me if you feel any tenderness.
No.
Okay, go ahead and breathe in and out for me. Okay, patient has no tenderness noted. Chest expansion is equal and symmetric bilaterally. Okay, what I'm going to do now is I'm going to place my hands on you, and every time I place my hands on you, you tell me if you tell me 99. Okay?
99, 99, 99, 99, 99.
Okay, patient's vibrations are normal and heard in the correct intercostal spaces. What I'm going to do now is I'm going to percuss, okay? Okay. Okay, patient resonance is heard over the correct intercostal spaces of the thorax. Now I'm going to have you breathe in and out for me every time you feel my stethoscope, okay? Okay, now I'm going to come to the front side. While I'm on the front side, before I continue with the thorax, I'm going to go ahead and I'm going to palpate your temporal pulses, okay? Okay. Patient's temporal pulses are 2+ bilaterally, okay? Now what I'm going to do is I'm going to ask you if you feel any tenderness on the front side, and I'm going to percuss and do the tactile formitis, okay? Do you have any tenderness anywhere? Okay, no tenderness noted. I'm gonna do the same thing on the front side. Every time I do this, you just say 99.
99, 99, 99, 99, 99, 99.
Okay, patient's vibrations are heard on the anterior side, in the right intercostal, correct intercostal spaces, as they were heard in the correct intercostal spaces on the posterior and lateral sides as well. What I'm gonna do now is I'm gonna percuss over your front thorax, okay? Okay, resonance is heard in the correct intercostal spaces. Alright, what I'm gonna do now is I'm gonna have you sit straight up and I'm gonna go ahead and palpate and listen for your carotid arteries, okay? And how about okay, patient's carotid arteries are 2+ bilaterally. What I'm going to do now is I'm going to have you to lay down and I'm going to listen to your heart sounds, okay? I'm on this side. Okay, aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to go ahead and, okay, and I'm going to go ahead and I'm going to find your apical pulse. I'm going to palpate for it. I'm going to go ahead and listen. Patient's apical pulse rate is 71 beats per minute. Okay, and as I was listening to heart sounds, S1 was heard best at the apex and S2 was heard best at the base. S3 and S4 were not present, so there are no murmurs or bruits noted. Okay, is it okay if I go ahead and expose your stomach so that I can look at it and auscultate for your bowel sounds? Patient's stomach is round, non-distended, and flat, with no abnormalities noted. Okay, I'm going to go ahead and auscultate. Bowel sounds are present in all 4 quadrants, and patient's aorta is 2+ and no abnormal palpitations are present. I'm going to go ahead and I'm going to start with a light palpation. You can tell me if you feel any tenderness, okay? Any tenderness? How about now? Okay. There's no tenderness noted upon light palpation and no masses are present. Okay, I'm gonna do it a little deeper, okay? And tenderness. Okay. There is no tenderness noted upon deep palpation, and patient's organs of the stomach are all intact with no movement. Okay. What I'm gonna have you to do now is I'm gonna have you to sit back up, and I'm gonna come around. I'm gonna go ahead and I'm going to have you to shrug your shoulders against my hands, okay? Cranial nerve 11 is intact. I'm gonna have you to go ahead and repeat the phrase back to me that I tell you, okay? Light, tight, dynamite.
Light, tight, dynamite.
Patient's cranial nerve 12 is intact. I'm gonna go ahead and I'm gonna do your palpate for your brachial and radial arteries. Patient's brachial arteries are 2 plus bilaterally. Patient's radial arteries are also 2 plus bilaterally. Okay, what I'm gonna have you do now is I'm gonna have you take your arm out and up and swing them around. Okay, and then I'm gonna have you grip my hands. Patient's range of motion in the upper extremities is 5 plus, and measurable strength is also 5 plus bilaterally. Okay, what I'm gonna have you to do now is I'm gonna have you lay back down. And we're gonna look at your lower extremities, okay? And finish listening for your pulses, palpating them. Patient's lower extremities are symmetric. Skin is warm, pink, and dry. No hair is noted. Okay, I'm gonna listen for your preview. Okay, patient's popliteal pulses are 2 plus bilaterally. Patient's posterior tibial pulses are 2 plus bilaterally. And I'm gonna have you put your feet down for me. Patient's dorsalis fetal pulses are 2 plus bilaterally, and capillary refill in the lower extremities is less than 3 seconds. Okay, what I'm gonna do now is I'm gonna run this up your toes. Flex your feet for me. Patient's Babinski reflex is not present. What I'm gonna do is I'm gonna have you flex your feet towards the ceiling and push them against me. Okay. Alright, I'm gonna have you to get back up. And I'm gonna go ahead and do your deep tendon reflexes. Okay. And I'm going to have you go ahead and stand up for me. I'm going to have you walk from here to the wall with your heels to your toes and back to me. Okay, patient's gait is steady. And alright, I'm going to have you to swing your foot forward, swing your foot backwards, out to the side and back in. Patient's range of motion, do it on this side as well. Patient's range of motion in lower extremities is 5 plus bilaterally. What I'm going to have you do now is to put your foot up and bend down through the knee and do it on the other side. Patient's balance is also steady. I'm going to have you turn around and close your eyes and stand straight for about a minute. Patient's Romberg test is negative. I'm gonna have you go ahead and push backwards to the side, to the other side, and down to your toes. Patient's spine is midline with no curvatures noted and no scoliosis. Patient's range of motion for the spine is 5+. Okay? What I'm gonna have you do now is I'm gonna sit back down, and I'm gonna have you to close your eyes. And I'm gonna have you give me your hand. I'm gonna have you tell me which way your finger is going up or down, okay?
Up, down, down, up.
Okay. Patient's kinesthesia is present and intact. I'm gonna have you to close your eyes. I'm gonna have you to tell me what I put in your hand, okay?
Key.
Yes, patient stereogenosis is present and intact. Okay, and I think that is it. That concludes my assessment. Do you have any questions for me?
No.
All right.